Dear student, today I am going to explain a new topic about pharmacokinetics. In last previous classes, when I discussed about sort in route of administration, there also I started pharmacokinetics, but that was very short discussion about that. But today we are going to discuss in details about pharmacokinetics. What is the pharmacokinetics? Why we have to study pharmacokinetics? What we have to study in pharmacokinetics? And what is the role of that pharmacokinetics in our human life or in that medical field. So what is pharmacokinetics? Pharmacokinetics is a quantitative part of pharmacology where we are going to study about how the drug goes into the body, then pass through into the body, and then excrete out from our body. So according to that, how that drug is going to enter, how the drug is going to distribute in our body, then how that drug will go through different kind of chemical reaction in our body, that we are calling metabolism. Then the part what is not required for our body is excreted out through different route of elimination, what we will discuss in that class only in short. So according to that, how that drug is coming, how the drug is administered, how the drug is working, कैसे ड्रग को दिया जा रहा है, कैसे ड्रग का डिस्ट्रीब्यूशन हो रहा है, कैसे ड्रग डिफरेंट प्रोसेस में अंदर जाके फिर रिमेनिंग बाहर जा रहा है, उस प्रोसेस को ही हम लोग एक साथ बोलते हैं फार्माकोकाइनेटिक्स. तो इस हिसाब से फार्माकोकाइनेटिक्स को स्टेप को 4 पार्ट में डिवाइड किया जाता है, ADME, where A is stand for absorption. Here what we did in absorption, we are going to study how the drug is administered into our body. Then what we have already discussed, how we are going to administer. In absorption, we will study after administration of the drug into our body, how the drug is slowly absorbed in our body through different membranes what is present in our body, and different process what is involved in absorption of a drug, what we are going to discuss about next class in all that topic about absorption, distribution, metabolism and excretion one by one in one class. Today I am going to explain only in small how pharmacokinetics works and what is ADME. So first is ADME, that is process of absorption. In that drug is going to administer into the body, then absorbed by different part of the body and different membrane of the body, and that absorption is depend upon different factors. All that factors and the process of absorption, how it is going to absorb, everything I will discuss in details when I will discuss one by one into the next classes. So next one is distribution. What is distribution? After the body is administered and absorbed by the membrane, then how the drug is going to distribute throughout the body. Because we know when we are taking any drug, we are taking it by any route for one reason, that is for curing or preventing any disease or for any disorder that is going in our body. For that, that drug need to be administered and that drug should be reached into that sites where that drug is going to work and going to treat that disease or that thing. That for that distribution is important of in drug. Here we will study how the drug is distributed in different part of the body, different tissues of the body, different organs of the body, and how it is going to distribute throughout our body and is going to reach that main site of action where it is going to act for the intended work for which we are going to take that drug. And that is also depend in different factors, that also I will discuss in distribution part. The next one is metabolism. That is the one of the main important part of that pharmacokinetics. What is metabolism? Metabolism is a process in that what we are going to taken the drug, after distributing it in different part of the body, it is going to metabolize. That means that that will go through different chemical process. The drug will go through the different process and it will break into small pieces and into different chemicals by different body mechanism in different parts. Here two types of metabolism is there. One is fast pass metabolism, that is generally for oral drug of administration, where the taken drug is going to fast pass, where the drug is going to metabolize through the GIT or gastrointestinal tract, where different juices in gastric, stomach and intestine is going to process that drug and going to break it into small pieces, and that will be reach into the different action site where the drug will show its action for which we are going to taken that drug. And that metabolism process also is two types, that is also called as biotransformation, first phase and second phase. That also we will discuss when we will go through that metabolism in upcoming classes. The last one is excretion. That is the last process in our pharmacokinetics, and it is also very important for that drug. After the drug is going administered, then distributed, then metabolized, then the drug is reaching into that action site and showing its action. But what the drug we are taking, that whole drug is not used for that treatment, and our body can't utilize that whole drug. If we are taking 100 grams of drugs or 100 mg of drug, in that only 10 mg drug is used by the body to treat that disease. That 10 mg only in our body is going to metabolize, and the remaining drug that is becoming waste and it doesn't require for metabolism and it doesn't go through metabolism. Only that 10 mg is required and sufficient for the intended use for which we are going to take the drug. And that remaining drug, after using the 10 mg, what is going to require for that intended work, that remaining 90 mg, what is unprocessed and unmetabolized, that is going to excrete from the body, in different route of elimination. Like most of the drug eliminate through the urine, but except urine, also different paths are there by which that drug is going to excrete. What is in metabolized is going to excrete from our body, that are feces, saliva, sweat, air, milk, etc. Different routes are there. All that route also we will go through when we are going to discuss about excretion in the upcoming classes. But you have to remember, whatever the drugs we are taking, most of the drug, almost 60 to 70% of drug, they generally excreted from our body by urine. And for all the pharmacokinetics parameters, for absorption, metabolism, distribution and excretion, all that process are depending upon different factors, what I am going to explain when I will discuss ADME in upcoming classes. Thank you. And whoever wants to study all the topic what I am covering in each day, all that are written in handwritten notes which are already uploaded in my Google Drive, and they are given into the description. You can check my description, there already Google links are given. From there directly you can click and you can download notes for each classes. Thank you.